One of the downsides from a lot of those injuries is pain medication, and you had issues with
I
that.
did.
How addictive can some of those be?
It can be brutal. And listen, you know, I never in my wildest dreams ever thought I would become addicted to drugs. I mean, I didn't smoke, I didn't drink, I've never done any illicit drug in my life. My parents, who I love dearly, are both gone now, but and they were recovered, but they were alcoholics as a kid growing up, and I saw what it did to them, and I thought, boy, that is not going to be me. And then, you know, I got hooked on these on this narcotic pain medication, and I don't blame anybody other than myself for letting it happen. But you know, I don't use this as an excuse, but I was in a short period of time, over just a few years, I was in a number of accidents and multiple surgeries, and I started getting hooked on this stuff. And then when it was time to get off of it, I didn't like the way I was feeling trying to get off of it. And so then I started going to another doctor that didn't know me, and you know, I get prescriptions from them, and you know, they always say, okay, this is good for a short period of time. And listen, for a short period of time after surgery, or you break a leg, they're great. People need them. Most people aren't going to have any problem with them. But it's when you have chronic pain, like I did for quite some time with my back, you get chronic pain where you're on them for extended periods of time, and it's very difficult to get off of them, because I don't care how slowly they wean you off of them. If you've been on them for a period of time in excess of 3, 4, 6 months, many people years, your body it doesn't know how to live now without that stuff. All of a sudden you're pulling it out of your system, and it's like begging for it. And the withdrawals, when I got to the point where I was, you know, going from doctor to doctor to doctor, and then I started forging my own prescriptions. I mean, I'd never been in any trouble in my life. I'd never stolen as much as a piece of bubble gum, and now I'm doing something that I knew was totally against the law. It was totally against what I believed in, but at the time, all that mattered for me was to get the drugs, take them, and make sure I didn't get caught. I mean, it had me so under control. That's all I thought about 24/7. And thankfully, you know, I got caught before I died or killed somebody else driving under the influence. And now, you know, coming up in about a month, you know, God willing, I'll have 16 years of sobriety. Sorry,
That's
I always
right.
but it was a struggle, and it's something I have to think about every day. And I've been tested, you know, 2 knee replacements in the last 4 years, but this time, for me, you know, there's always a plan in place now. And my wife Jill handles any of my medications if I needed any after I got out of the hospital. My doctor knew. I was right up front with them, and at first I remember when I had my first knee done, I didn't want to tell the doctor about my past, because I thought, gosh, they're going to do this knee thing. They probably won't even put me to sleep, and I'm not going to get any pain medicine. And my wife Jill says, we're not going to let that happen. And it didn't happen. And you know what? They monitored me in the hospital, and then when I got out, we had a pact made that only Jill, my wife Jill, would dispense the pills. I couldn't get them. I didn't know where they were. Only she could call the doctor for a refill, and only she could go to the pharmacist and pick them up. Now, could I have done that on my own? Maybe. But why take the chance? Because I honestly, 16 years almost of sobriety, and I can't honestly say that I could guarantee you I could do that without taking an extra one here or an extra one there. That's how powerful those drugs are. So you got to be so careful. And for the people out there that, you know, have had problems in the past, like broke a leg, surgery, they're sent home with pills, you know, after a few days, they're feeling fine, they don't use them, but they still got them sitting up there. I'm telling you, they are the fastest form of addiction going on right now. And kids are they're breaking into homes, first thing they're doing is going to the bathroom, looking in the cabinet for the pills. Get rid of them. Take them to the, you know, somewhere to just to get rid of them, because it's an epidemic, and it's getting worse and worse as we speak. And doctors are between a rock and a hard spot. They're compassionate people. Nobody wants to see people suffering, but and they just got to be really careful. both the doctor and the person taking the medication that it's not overdone.
Certainly not everybody gets addicted.
No.
But what's your advice, and you speak a lot about this, what's your advice to people that, might get that first prescription for a surgery or chronic pain or something like that? What sort of advice do you give so that they are able to, limit it?
Yeah, is take it as prescribed. If you think you might be worried about it at all, let somebody else dispense it for you. Let somebody else, your loved one, a neighbor or somebody, if you're an older person living on your own or whatever, if you're afraid of the drugs, but you need it, that you might, take too many, or you're afraid you could get hooked on it, have somebody else monitor it. But if you can't do that, if you take them as prescribed, use them like they're supposed to be used, over the extended period of time, you shouldn't have any problems at all. I mean, the doctors are trained to know of, and most people, some people are going to be off this, are going to need more than others, and that's just who they are. Others are going to need less, but for the most part, the doctors pretty much know. And there's a timetable, and if you go beyond the timetable, the doctor's going to start questioning you, or he may reduce you to a lesser strong type of narcotic, and eventually you get off of it, and you're right. Thankfully, most people don't have a problem with it, but some people do, and if you've had a past with problems with alcohol or drugs, either being street drugs, tell your doctor. Don't be foolish like I thought I was not going to get anything after total knee surgery. They're going to work with you. But if you're honest with the doctor, then they can make sure that you're not going to go back to that level. Because I don't think anybody that's been addicted to drugs and then got clean ever wants to go back to there again. I don't know why they would, because it's nasty.